bloggers, we've talked to journalists, we've talked to economists, and really a wide range of figures. And today we kind of want to look overseas a little bit and understand what has been happening in South Korea, which is a country that has been discussed very often as a successful model for how to handle this, often presented in contrast to what unfolded here in the United States. And we're hoping, especially as we enter whatever phase we are in of this pandemic, to find insight from what other countries have done as all the states and the national government here try to work through this. And today we are honored to have with us Dr. Young Chun, who is the Research Director, Interdisciplinary Research Science and Senior Survey Methodologist. He's one of the go-to experts for administrative data research. He is the Director General of the Statistics Research Institute of Korea, the state-run think tank of official statistics and data innovation. He's also a faculty chair at the Pyongyang Summer Institute for International Data Science. He's the chief scientist at the International Strategy and Reconciliation Foundation, the Institute for Strategic Reconciliation, a nonprofit, independent Washington-based think tank. And he's involved in just many different areas. He's published extensively, and he is someone who has firsthand knowledge of what has happened. And really, it's a delight to have you with us. So thank you so much for joining the show, Doctor.
Yeah, it is my great pleasure to be joining you in this, I think, the very important time that we all are very, I think, aware of this pandemic, crisis.
Maybe we can start by just asking you currently, right now, what is the state of things in South Korea? How are things unfolding? What's the state of the pandemic? Maybe just to have some overview of what things look like in May 2020.
Yeah, I think that to make a long story short, we are at the stage of actually the exit plan. So we are implementing sort of, I think going back to sort of new normal life after going through this extensive, response and stemming period when it comes to this pandemic since, the first part of February. It's been a long time, but nation has been very resilient when it comes to the scientific tools of handling this pandemic crisis. So at the moment, perhaps I can tell you more about what is happening in this the process. But at the moment, we actually have this new normal stage. What I mean by that is that we actually have a pretty good balance of having people going back to school, and I think a step by step. And also, most people actually also are working either in the office or home as a kind of telecommuting. And most of restaurants are open. But we have all this personal level of hygiene system well in place. We also have a pretty good system of testing, tracing, and then treating patients in place. And then that's where we are.
And while preparing for this show, Jason Rode, who helped us get this together, along with Rose Huber, we have a study we saw from the Korea Centers for Disease Control and Prevention, which is about an outbreak in a high-rise building in Seoul where there was early direct intervention. The building was closed, and you had testing and quarantining, and it's kind of a model it's become a model of how to handle this fast. And although that's from early on, it's still going to be relevant now as people are thinking of reopening. Could you talk a little bit about the process of dealing with that building or with the spread of the virus as it unfolds?
Yes, I think when it comes to the process of dealing with it, I'd like to sort of explain this grounding process of this, how this pandemic, particularly coronavirus 19, is just working. If you like to really understand the process of stemming and preventing and then responding to it, you got to understand how this pandemic is actually being reproduced. So in the epidemiology, we usually say this reproduction rate is the function of the probability of infection. That's the first factor. And second is the this sort of social contact rate. Third, duration of infecting other people. So you got to really think about how to operationalize those three variables when it comes to actual policy making and then health system to be working. So for the first component, when it comes to this, sort of, personal level infection to be controlled, you got to have a pretty good personal level hygiene and washing your hands. Very mundane practice, but very important. A lot of people take it granted, but in countries like India and in other developing countries, this is not necessarily granted. So that's the one important practice that Korea has been doing since its outbreak and then way back in February. The second variable, I mentioned, this is the sort of the social contact rate. This is also very important, I think, the variable to control. How would you handle it? This is where I think the personal level and societal the level, I think the behavior should be really well controlled. How do you do this controlling of social context? This is where the schooling comes. I think that you got to have sort of online school rather than offline schooling, and I think a telecommuting rather than the office work. And there are many other this social contact rate, I think, the controlling process. The last variable, this is actually key to the this whole, I think, the controlling process. This is where you want to control this duration of the infecting other people. This is where so-called the 3T system comes in. This is where Korea has been really, I think, the excellent to handle it.
3T, is that what you called it?
Pardon me?
Sorry, define that term. You called it a 3T or something like that?
Yes. 3T stands for, the first T is actually this treating. I'm sorry, the testing patients with test kits. Without testing, you cannot trace people. And then, so this is the very important part of this 3T. Second T is actually tracing the sort of movement of this infected person and also other people, I think, who have been contacted. So that tracing mechanism is also very critical. Third component is actually treating patients by classifying patients at, I think, by the level of different levels of, I think, their condition. So this 3T is the very critical, I think, the process that Korea has been, I think, the controlling. And then I can tell you more about how we have done it. But just to be very short, I think we try to be really operationalizing those three variables that are critical to controlling this the reproduction rate of the pandemic.
Could I actually want to just jump back for a second before Sam continues with this line of questions, but maybe you can explain for our listeners. I described your jobs and positions, but what you do and what your role has been in the last few months, so people understand that.
Okay, so I told you about this 3T, testing, tracing, and then treating patients. So when it comes to this whole process of doing this kind of, I think, a system in place, we got to understand how this pandemic is just going to unfold. What do I mean by that? We got to actually model the behavior of this coronavirus 19 and forecast its course over the next few months. I'm calling it nearcasting rather than forecasting, because we like to really forecast the near future, next month, 2 months later, and then 6 months later. So my primary, actually, I think the duty is to lead the national team of predicting and forecasting this near future based on this model that actually very well incorporates, I think how this pandemic is actually behaving. So that has been my role, and make sure that we have a pretty good understanding of how this pandemic is going to unfold. And based on it, we can come up with a lot of those important policy-making measures that I can connect to those 3 factors I told you about. When it comes to schooling and opening, the business, and also the opening other things in the economy. And this all depends on the extent to which you understand the course of this, pandemic behavior. So that is my primary job. And second is actually to connect this data and evidence to policy making in, economy, science, public health, and then other measures that a nation has been actually implementing in the past several months at the higher level and also bottom up.
Right. So this is all super interesting. I will say that I have a pretty strong interest in, as you say, near casting. Sometimes one can think of it as now casting, what's going to happen in the next day or week or what have you. For us, I think one major area of interest is that for any, say, intellectual person who has been watching this pandemic unfold in different countries around the world, there's a familiar story about the elements that go into a strong response. And one thing that strikes me as very interesting about the South Korean experience is that many of those elements have gone very well. In a democracy where people have a lot of personal liberties, there's a lot of freedom of speech and so on. And so in some ways, it's an interesting test case in how these things can work well in a society with a lot of freedom. And so I wonder if I could maybe get into some of the details with you about how your expertise interacts with public awareness and exactly public reactions, which gets maybe a little bit away from your expertise, because it's where your expertise then collides with everyday people. So one question I have about near casting is that one thing that sometimes people look for in the style of hurricane forecasting is looking ahead for multiple days or what have you, but those forecasts change. And in the United States, there's been dissension about the treatment of models. And there's been a real variety of expectations. And I wonder if you could just walk us through exactly how many days ahead do you nearcast for? How do you disseminate that? And how do people react to it? What do you expect Koreans to do with that information?
Okay, this is actually a very big question, but I think, given short time, I'll try to.
Just to interject, although
yes.
I love the details, we're not going to do there's a granular detail that I really want to ask you, but I am afraid to, because I think we get lost in it. So this is for intelligent but not people who don't do differential equations.
Yes. Let me try to speak in I think the common people's language here. So when it comes to modeling, we got to actually understand how this, again, the infection is actually spreading out. So we have this very well, I think, the practiced model, so-called SIR. We actually classify entire population into 3 groups. Susceptibles, those people who are potentially infected. It is talking about almost everyone, including you and I, and then everyone else. And second group is actually the I, that is the infected population. So some people may be infected, others maybe not. And third group, once they're infected, some of them may be recovered, or some of them may be passing away. So the model that we used is called IDEA, Incidence Decay with Exponential Adjustment. It is basically the model that reflects those 3 factors that I just told you about: susceptibles, population of the susceptible, population of infected, population of the recovered or dead. So this is the model Korea and then Canadian scholars worked together since the start back in, I think, the early the March. We have a very limited data. This is the crisis, time that no one has the complete data. So what would you do about it? You got to rely on some model, very rigorous, very simple model that can use very simple input data, like the number of instances every day. That's good enough. We don't need anything else.
But that's with adequate testing, though. So, for instance, if you didn't have testing, you'd have to use, I don't know, ICU bed occupied or deaths or something like that. So it seems like testing is a necessary input to getting that model to have good inputs in a timely manner.
Yeah, that's right. So all we needed, in this model was the number of the daily instance, and then use that as an input data. And again, when it comes to all those testing and then other things, they are already factored into this model. And then how many people were actually infected, and based on all those testing systems and so on. So this modeling itself happened early March. And then we did this modeling almost every week. So far, we have done 6 times. And to predict what is going to happen, when we modeled the first time in first week of March, we tried to model the whole behavior of this pandemic in the next, I think the 6 months. And then what is going to happen? How this, the life course is just going to change over time, given some assumptions that we have. Some of those assumptions is that the government is just going to actually practice this the system of 3T testing, the tracing and then treating pretty well in place, and then public will be actually very in compliance with all those measures and those kind of assumptions, because no model is just going to work without those kind of assumptions. And so this is not easy to handle, but given those assumptions, we try to model the whole life course. And so we try to measure what is the sort of, this high point where this number of daily instances is the highest. And then when it goes going up and then down and eventually, coming down. So we could sort of see the whole life course based on this basic, daily input data. And that's how we came up with this model, and it behaved pretty well.
Were the outputs of this model used by the general public, or was this for internal consumption for targeting resources and making decisions?
Yeah, so this is the actually the model. So if I understand your question, this is the model that we actually come up with, and then we shared this model with policymakers internally, so they can make data-based decisions from the start. Public, I think some of the actually, I think the experienced public also had exposure to this kind of, I think, the modeling itself after some time, because we didn't want to confuse the people with perhaps the false hope, or perhaps the incorrect the forecasting and things like that.
Right.
So in the Korean case, we try to,
Yeah, because in the US, deviations from the model have come in for criticism, because as you know, there is not general political agreement in the United States about response, and there hasn't been very much coordination at the national level. And in such an environment, many voices are considered equal. Let me back up a little bit. I'll be honest with you and say that I personally love SIR models, but I would guess that maybe 1 out of 50 of our listeners understand these things. So I ask with an apology that we get back into some generalities. And I really want you to forgive me for asking some fairly basic questions. To what extent was Korea's response helped by the experience of the first SARS epidemic? Because my general feeling in the United States is that many of us here in the US didn't have a strong intuition for how to respond and how important it was to respond quickly. And I wonder if there was a general public understanding of this, and if it was driven in any way by the first SARS outbreak.
I think this is a very important question. I think that thanks to the SARS, Korea has been very conscious about what they should do in case another, I think the outbreak or pandemic, the epidemic is going to hit Korea. So since the SARS and then MERS, the crisis, the epidemic, the Korea has been trying to actually develop sort of this the system of the testing early on. And also we try to also institutionalize what we should do legal-wise, to what extent we should actually provide the personal information to the public. So we can actually come up with some of these public health measures or share some information. I think the and over this, I think the personal, I think the liberty, I think that many people actually try to protect. And this was not an easy decision, but I think that law was institutionalized several years ago after the Korea went through this SARS and MERS crisis. And so in case of crisis, there should be some, I think, the legal process or some I think, the degree of protecting the public health over individual liberty.
So is there a public consensus over that? Because privacy concerns, like here in New Jersey, for instance, Governor Murphy is planning on hiring thousands of contact tracers. And I think this is fantastic. But the moment he announced it, a legislator started complaining about privacy issues. And on the one hand, he's got a point. On the other hand, we have a public health emergency. So is there a consensus in Korea on this particular topic?
I think that has been a very important issue. But I think, like I told you, the law had been already institutionalized several years ago. And that was based on the consensus and then public's, I think, a compliance with these legal measures. So when the crisis happens, this is only, I think, restricted to this crisis period. This is not for the ordinary use. But when the crisis hits the country very severely, like this pandemic, then people are ready. Okay, for the sake of protecting many people's lives and keeping them healthy, I think some people I think they try to actually can actually give up some amount of their personal freedom.
Yeah, we don't really have a consensus on that here.
Right, we have a consensus on nothing here, and I think that's a problem. That's one of the challenges, obviously, in a crisis that requires expert-based guidance.
Yeah, but I'm not saying I think that Korea has completely given up this the privacy and personal freedom. I'm actually saying that the Korea try to keep the balance between personal freedom and then public safety and public health. So you got to think about one person's personal freedom versus the many people's, I think, their life at stake, and then what should you do in this time of crisis? And this is a decision that you have to make before the crisis hits one country, and that was what Korea has already institutionalized many years ago, and that there was the public consensus on it and support in general.
Yeah, you've talked a lot tonight about testing, about washing your hands and tracing. But from my understanding, it's also important that in South Korea, there were certain institutional pillars to dealing with this. So by that, I mean hospitals had adequate equipment so that hospital workers could deal with patients as they came in, and it wouldn't bring down the hospitals. From what I understand, the government was more aggressive in covering the costs that citizens faced because of this. So there's not a temptation to run out as quickly and get back to work. Is that not true, that that's also part of the story that you have seen unfold?
Yeah, that's right. This hospital resilience to deal with, the patients of different kinds. This has been very important because we got to be very mindful whether the nation has the capacity, the hospital capacity and health capacity to deal with this crisis if this is going to be really enlarged in an exponential scale, and then can we handle it? So this was a very important question from the start. So that's why we try to have all this the 3T measures, and also those person and then the societal and then governmental level sort of prevention. And then hospital system has been actually well prepared to deal with this crisis at the national level and local level. We have 17 the major provinces and cities So we needed to make sure that each of those 17 the areas is ready to handle this crisis if any local outbreak happens in each of those places. And it actually happened in this one of the southern I think cities and then southern provinces, and it took some time. But I think the nation's the hospital and health system was ready, and then we needed some additional the health staff. Also, we had many volunteers from other provinces and other cities who actually decide to help out those medical staff in the southern province.
And I mean, Sam and I both work at Princeton University, and in the United States, the conversation has now shifted, from flattening the curve to how do you gradually reopen. Most states are reopening. They're doing it in different ways, which is problematic, obviously. But in terms of what you're seeing, you started the show by talking about the reopening of schools, of restaurants, which is what everyone here is hoping for. Are the same pillars you've been talking about, haircuts, are the same pillars of handling this, are they the same ones that are necessary as reopening happens? Are there other specific steps that you think are needed? Schools are on most people's mind right now, not just universities, but secondary education. What has to happen to make this work relatively successfully until there's a vaccine?
Yeah, so I'm going to talk about briefly again those three pillars, because those three pillars are critical to reopening. If we are ready to use those three pillars, personal level hygiene, and then using the masks. And this is actually very ordinary, but I think the United States can handle it pretty well if they are in compliance with it. And the third factor I mentioned was this duration, the testing, tracing, and then treating. I think this is another area that U.S. actually can handle pretty well. I think perhaps each state has different, a level of capacity, but I think to some extent, I think you can handle it. When it comes to the second the measure, social distancing, this is where I think many people have different opinions, and then states have different sort of measures. How would you open? How soon would you open the schools and make it offline, the opening rather than online? Would you have the people come back to the office rather than teleworking and so on? So I think this is where I think we have different sort of standards or different sort of commitments. But what I can say here is that as long as we are very well ready to handle the first pillar and then third pillar, I think you can do some sort of dynamic distancing on and off. What I mean by that, rather than traditional social distancing, you have pretty tight control of social distancing every place. You like to have dynamic distancing on and off. So once you have this first and third pillar well in place, now you can control these different levels of social distancing. When it comes to online and offline school, once you open the school, I think they actually have students, go to the school, and if there's any outbreak, do you have a system to deal with it? Are you ready to handle it? If not, you cannot actually open the school, the offline, and that's where Korea is at.
Okay, but that requires rapid response in order to get quick data, because you need like day-by-day resolution. You can't rely on waiting. You can't wait a week for data.
Exactly. So that rapid response team is very critical to this whole process of reopening. And we actually, the school system and also many of these, I think a government dependent, nation's system has been trying to prepare such a rapid system in place before we decided to open the schools. We actually, postponed this the offline school opening multiple times in the past few months, because we thought we are not there yet. In terms of number of daily incidence measures that we have, we try to use as a sort of threshold. And then we try to also have first and second and third inspection of whether each school is ready to handle. And then they can use this sort of rapid response system. If not, we have to, I think give more time to school and then these 17 cities and provinces. And so that kind of rapid response system is very important to make sure in place before you actually start reopening, many of these schools and restaurants and other businesses as well.
I can see Sam's ready to jump in, but this is beyond your expertise. It's also just you're living there. What does this look like? I mean, what do the schools reopening look like? What do the restaurants look like? What does this physically look like if we were seeing pictures of it, just so we have a sense of it?
Okay, so I think as Sam mentioned that, hair cutting. I don't have any problem to cut, I think my hair. I think I've done it almost, every 3 weeks. I think people just go there. Yeah, and then I actually, when I go there, they tell me that I don't have to wear a mask because all those hair cutters are using their masks when they work. So when they do that, some actually, I think our customers may decide to use the mask when hair cutting, but I decide not to because hair cutters, they are ready and then they are masking, and so I think I felt pretty comfortable. When it comes to schools, I think the schools are actually, the Korea was the first to actually have the online school opening among all the countries in the world. And this was not an easy decision. And we tried to actually have each student to have online tool to connect to school and then to teacher. And this was the system we actually institutionalized. And this was the first time in the nation's history that we tried to connect everyone online when it comes to primary and secondary schools. But now when it comes to offline opening, because we cannot just rely on online opening in this kind of crisis, we try to kind of balance the online and offline. So when it comes to offline, I think each school is supposed to have, I think some standard, I think the distance from each, I think a desk. And so the students can have, I think a bit of, I think the sort of, we usually say what, I think 2 meters or 3 meters, so that standard distance to keep. And also students should wear masks in classrooms. So this is also very important.
In classrooms.
Yes.
Okay. Uh-huh.
And also they need to have this temperature measure when they come to school. So every student should go through this gate to measure their temperature before I think they actually entering their classrooms.
How does that help in the case of asymptomatic transmission and infection? Like, doesn't that miss a lot of cases?
Yes, I think that's very important question again. I think you actually pointed out very important nature of this pandemic. So we have concerns about those cases. So that's why we are actually encouraging all those students. We're actually mandating all students to use masks during the classroom the period. And also they have some, I think the adequate amount of distance from each other. And so again, who knows, when this, if this asymptomatic, I think the, case happens among some students. In case that happens, again, I told you, school is ready to kick in this rapid response system in coordination with, I think, the local administrators and also Korea CDC and other rapid response teams. And then that's where we are.
And if there's an outbreak, then one business shuts down or one school shuts down or one block. How much gets shut down if there's a reemergence? Okay.
Again, that depends on, I think the nature of that outbreak. I can tell you about this outbreak that we just had in this, one of the major communities in Seoul. It's called Itaewon International, I think the community. And it happened as soon as we actually, had this sort of dynamic on and off, or sort of new normal that we started off. And once it started, we tried to actually, again, use that system of the 3T. We try to actually, test as many people as we can within the network. And within that network that we actually find out using all those high-tech, big data system. And so we traced all of them and we tested them. we actually, have tested about more than 60,000 people in a few days. And we had that system in place, and that system was kicked in. We actually found out many of those patients across the nation, just a few here and there. And once we have all those in control, we actually confirm, I think we are pretty comfortable that we had it under control. So that's the kind of system that I think that we have if any outbreak is happening in any school or in any business community or in any local area.
And one of our producers who's worked on the show, who works at the Woodrow Wilson School in the public relations, asked a question related that Princeton and other colleges and universities now are trying to plan the fall semester and how to reopen the academic year. But the challenge is social distancing with people 18 through 22 is not very easy to do. And she asked, how are colleges and universities in South Korea trying to tackle this in terms of the reopening?
Yeah, this is the same question that I think the higher education administrators have been actually discussing about. So the first option is that perhaps many of these schools may continue doing the online schools in the first semester. Actually, in Korea, we have different sort of semester system here. So we have I think almost every school currently using the online the semester in higher education. When it comes to preparation for the next semester or even for the summer, again, I think these schools are planning to have sort of mixed online and offline. And depending on this system, the pillars that I told you about, if each university is ready to handle and with sort of rapid response system. Again, we are talking about different population here. Very active population, the 20s and 30s. And we know the reproduction rate, I think in that particular case, may be much higher than this, 2 to 3 that we usually talk about this epidemic. It may be, even, 4 to 5 when we talk about this, very young and inactive population. So we should have,
super spreaders.
Yes, you made it very well. Yeah, so that's why we have to have, again, perhaps the better use of the online system. And then if school is ready, again, using that rapid response system in place. Again, in terms of number of universities, we are talking about actually much smaller size, or much small number of the schools in comparison to this primary and secondary schools. We are, preparing for this, the offline opening of primary and secondary schools. Actually, it's going to start today, and then I think step by step in the next 2 to 3 weeks by different grades. So we are going to see what's going to happen among these first, the primary and then secondary schools, and we're going to learn the lesson, and we can use that lesson to higher education.
My understanding here at Princeton is that from what I've heard, there's going to be a lot of testing of several types. There's a saliva-based test that's being implemented, or that's being talked about being implemented, developed at Rutgers, which is half an hour north of here. There's going to be testing at the Student Health Center. So I think there's going to be a lot of testing. My guess would be regular testing of students. I'm kind of curious about whether there's going to be tracing apps where maybe we could deploy apps to help them to help automate the contact tracing process, which of course raises privacy concerns. But Princeton, I think, is in a position of being relatively resource rich. I am concerned about schools that have less in the way of resources and how they're going to reopen, because I think that some of these things, for instance, frequent testing, would be somewhat expensive.
Yeah, I think in Korea, we actually do have the tracing app. And that has been very well utilized since the outbreak, and it has been advanced I think multiple times. So we feel pretty comfortable with using this tracing app. And again, this is the tool that we use many of these big data, the phone data, and then card transaction, and then CCTV data, all I think they mingle together, and we have a pretty good AI system of tracing I think the people.
Right.
But another thing I'd just like to add here is that tracing app is just very important. Speaking of this test you mentioned, Sam, just a second ago, we also need to make sure, when it comes to this very young and active, the super spread, the potential super spreader population, we got to understand, sort of prevalence of the asymptomatic sort of, the case. So we are actually planning to do a national scale of serological survey to detect antibodies among the general population. Depending on how we actually design this the survey, we can come up with a pretty, I think, the reliable measures by age, social demographic characteristics. So we can have a pretty good sense of, how much this asymptomatic case has been actually, I think, out there. And plus some of the critical measures that we can also help forecast the near future using the data from this serological survey. And then this is actually a very important part of, I think, the preparation in addition to this, the tracing mechanism.
We're nearing the end, and I've been given permission to really nerd out with you about and I'm just going to say, a phrase to you, but this is not for the listeners: reaction diffusion wave. And what I'm thinking about is the fact that we have this heterogeneous reopening around the country, where there was a big blast of infections in New York City that spread out. And you can see it in northern, central, and southern New Jersey, where in northern New Jersey, it also goes up and then drops off like that. In central New Jersey, where we are, it kind of goes up and it doesn't really quite hit a sharp peak. It looks like a wave that's kind of dissipating and spreading out. And then in southern New Jersey, it kind of rises gradually like this. And so you can imagine that it's like this spike of regenerative activity that then kind of fades. And by the time you get to southern New Jersey, it seems to have dissipated, presumably because we did an okay job of distancing. But now this is just an example of the kind of dynamics one can see if one wants to really nerd out and look at the math. But now I'm kind of concerned, because that's regional taming that was accomplished in New Jersey. And so we were able to contain the spread from New York City outward. But there are going to be re-outbreaks like this around the country. I'll give you an example. In Texas, they have their, I believe, highest number of cases and highest number of deaths quite recently. And the governor of the state has started reopening the state. Okay, so what I'm detecting is that there might well be a spike that comes out from Texas and then spreads out to New Mexico, Oklahoma, Arkansas, Louisiana. And I'm just a little bit concerned that if you think about the math of this, are we doomed to have these little explosive takeoffs of cases and then spread out over and over around the country? I'm just a little concerned about our lack of uniformity in our response. And I wanted to get your math reaction to this.
So actually, I've been very concerned about how, this pandemic is spreading out back in the States. I used to live in Maryland. I worked for the U.S. government, nearly 30 years, whether I was in the government or, business, the research community, or the scholarly community. And so I have my family back in the States. But now you gotta think about how this, the whole United States is consistent. It is actually basically, in a way, 50 countries put together. So if one country, one state is doing a good job, and it has gone through this sort of, bell-shaped, the life course, that state itself may have the second wave coming up, sooner or later. You got to be ready. But even after, I think one state like New York has gone through, or the Texas has gone through this crisis, and then they thought they handled it. But the second wave might be coming back to the same state. Or the other states, the adjacent to those states actually have the additional spikes. And this pandemic is actually going to travel throughout the 50 states.
Right, imagine a torch being put down in one place in a field and then spreading.
That's right. That's right. So I think the recommendation that I have made, I think the way back in March to my friends in within the Washington Beltway, I told them you got to have this action once for all for the whole 50 states. People in every state are behaving or taking the actions in the same at the same time in the same way. Otherwise, each of those 50 states, 50 countries, is taking different actions and different time of opening and reopening and things like that. This pandemic is just going to stay there perhaps the longest time among any country on earth. And that's concern. Again, no one is just going to actually have the wishes to travel to the state if this pandemic is going to travel again and again within 50 states. And then no one in the states also may be granted to travel outside 50 states to other countries on the earth. So this is the problem, not just for one state. This is not the problem for the whole the United States. This is the problem that we have to handle together, across the continent. But I just, I think you started off with this question, just with this concern about, across the states. But this is much more serious than that. So even between, the US and Canada, I'm closely working with my colleagues in Canada to stem this, I think the pandemic.
Right,
but you have the issues there. Yeah, right.
Maybe we should close the borders to different states in the US. Maybe New Jersey should close its borders.
Yeah. Again, it is not just closing borders, but I think if you have those three pillars well in place, even without closing borders, you can handle it. I think in the case of Korea, we had a concern about whether we should accept internationals at the airport. We are talking about tens of thousands of internationals flying in from China and many other countries in February and March. Korea decided to accept all of them, given the system we have in place, this testing, tracing, and then treating.
Because you were ready.
And some additional measures. So we have those systems, so-called drive-through or walk-through, testing system at the airport and other places when the internationals come in. And so we made sure that who is infected or who is likely to be infected and so on. We had some multiple measures of quarantine and then other, the self-quarantine and so on. But anyway, once we had that kind of system in place, we felt comfortable we can handle it, and without closing the borders. And that was the sort of basis, a sort of data-based and science-based system that we had in place, and then we leveraged, and then to continue this, I think the international travel. But at the moment, I think even Korean people are not granted to travel outside, because if they come back, they may be the source of the infection. And I think it's not going to happen, for a while. But we are going to get to the point once we have a better sense of how other countries in Asia and in other parts of the world may be handling this pandemic better with the kind of similar system.
Well, I mean, like many days, I have things you've said that make me feel optimistic and pessimistic. On the pessimistic, it is quite a challenge to transplant the model you're talking about to our divided and fragmented political system. On the other hand, you've really offered, I think, a number, I want to just close with this, very concrete steps that matter, that make a difference, and that have actually moved you back to rebuilding civil society, which is obviously what everyone wants to do, despite what you sometimes hear. But we want to thank you again, Dr. Young Chun, who is the Director General of Statistics Research Institute in South Korea, and who has been working on the front lines of gathering the expertise that's really at the core of fighting this pandemic, along with all the healthcare workers who are doing this. So thanks so much for joining the show.
It's my pleasure. I think I'd like to continue this international collaboration beyond this podcasting. So I'm happy to work with folks at Princeton and other universities, and then some of the listeners, so we can partner together to stem this I think the pandemic, because we got to be ready for the second wave, or some I think additional waves in case that vaccine and then medical treatment is just not ready on time. So we are all together to handle this crisis. I think with the synergy that we can create. And
Well,
thank you again for inviting me to speak with you.
I think that kind of communication is absolutely critical. Our colleague here, Sebastian Sung, has overseen a crowdsourced translation of South Korea's CDC guide. So I think there's just so much that we can communicate with one another. It would be wonderful.
But unfortunately,
yes, I'm happy to.
We'll do this at another conversation. I hope this is a seed for that. Once again, everyone who's listening, you can find us on iTunes, SoundCloud, Stitcher, and Spotify. You can also find all our shows at the Woodrow Wilson School website, and this will be on YouTube for people to watch. And we also have a great website, politicspolls.princeton.edu, that also has the show archives and all the information potential guests and listeners need. So everyone, thanks so much for joining us, and we'll be back soon on Politics and Polls.
Bye, everybody.
Bye-bye.